Diprolene Cream is used to treat a variety of skin conditions such as eczema, dermatitis, allergies, rash. Active ingredient betamethasone. Betamethasone reduces the swelling, itching, and redness that can occur in these types of conditions. This medication is a strong to very strong, high to super high potency corticosteroid. Indications. Diprolene ointment is a corticosteroid indicated for the relief of the inflammatory and pruritic manifestations of corticosteroid-responsive dermatitis in patients 13 years of age or older. How to use. Use Diprolene cream only as directed by a healthcare provider. Apply thin layer of betamethasone dipropionate cream to the affected area skin 1 or 2 times each day. Don't use more than 50 grams of this betamethasone cream in 1 week. Do not bandage, cover, or wrap the treated skin area unless your healthcare provider tells you to. Local reactions and skin thinning are more likely to occur with occlusive use, prolonged use, or use of high-potency corticosteroids. Wash your hands after applying betamethasone dipropionate cream unless you are using the medicine to treat your hands. Avoid contact with your eyes. Don't use betamethasone dipropionate cream for longer than 2 weeks in a row unless your healthcare provider tells you to. Tell your healthcare provider if the treated skin area does not get better after 2 weeks of treatment. Contraindications. Have had irritation or other skin reactions to the steroid medicine in the past. Have thinning of the skin atrophy at the treatment site. Have diabetes. Have adrenal gland problems. Have liver problems. Have cataracts or glaucoma. Are pregnant or plan to become pregnant. It is not known if Diprolene ointment will harm your unborn baby. If you use Diprolene ointment during pregnancy, use Diprolene ointment at the smallest area of the skin and for the shortest time needed. Are breastfeeding or plan to breastfeed. It is not known if Diprolene ointment passes into your breast milk. Breastfeeding women should use Diprolene ointment on the smallest area of the skin and for the shortest time needed while breastfeeding. Do not apply Diprolene ointment directly to the nipple and areola to avoid contact with your baby. Warnings. Use of topical corticosteroids, including Diprolene ointment, may increase the risk of posterior subcapsular cataracts and glaucoma. Cataracts and glaucoma have been reported post-marketing with the use of topical corticosteroids products, including Diprolene ointment. Avoid contact of Diprolene ointment with eyes. Advise patients to report any visual symptoms and consider referral to an ophthalmologist for evaluation. Allergic contact dermatitis with corticosteroids is usually diagnosed by observing failure to hydrophyte than not in a clinical exacerbation. Such an observation should be corroborated with appropriate diagnostic patch testing. If irritation develops, topical corticosteroids should be discontinued and appropriate therapy instituted. Side effects. Diprolene ointment can pass through the skin. Too much Diprolene ointment passing through the skin can cause your adrenal glands to stop working properly. Your healthcare provider may do blood tests to check for adrenal gland problems. Cushing's syndrome, a condition that happens when your body is exposed to too much of the common cortisol. High blood sugar, hypoglycemia, effects on growth and weight in children. Vision problems. Topical corticosteroids, including Diprolene ointment, may increase your chance of developing cataracts and glaucoma. Tell your healthcare provider if you develop blurred vision or other vision problems during treatment with Diprolene ointment. Skin problems. Skin problems, including allergic reactions, contact dermatitis, may happen during treatment with Diprolene ointment. Stop using Diprolene ointment and tell your healthcare provider if you develop any skin reactions or have problems with healing during treatment with Diprolene ointment. Your healthcare provider may do certain blood tests to check for side effects. The most common side effects of Diprolene ointment include redness of the skin, inflamed hair follicles, itching, and blistering.